It is with great pleasure, mga kababayan, that I introduce to you Dr. Joey Pascasio of Kaiser Permanente.
Good afternoon, everyone. Magandang hapon sa inyong lahat. So, when Camille actually invited me to talk to this presentation, I wasn't really expecting it to be this big. But I'm actually happy to be here. And well enough, these past few days, I was able to prepare, hopefully, a good presentation for the Filipino community. So, if you have any questions in between, if you need some clarification, it would be good actually to ask at the end of the talk, or if there's really some clarification that's needed to be done, you can just raise your hand. All right. So again, I'm Dr. Joey Pascasio, and I'm one of the geriatric physicians here in Kaiser Panorama City. So what we actually do here is we are one of the clinics that specialize in Alzheimer's disease or dementia. So compared to other clinics within the Kaiser region, we diagnose and follow patients with memory problems. Does anyone here does not know the meaning of geriatrics? Alright, so just to clarify, because it's very important, is that geriatric is a specialty which manages the health of the elderly patients. So if you have any problems, because geriatric patients have more problems than the typical middle-aged patient. So, if there any question or more need that's needed to be done, then seeing a geriatric specialist is actually better for patients 65 years old and older. So for today's topic, again, it's about memory loss and Alzheimer's disease. And what's the difference between normal aging and what's abnormal memory problems? So the objective, again, is to differentiate between normal aging and what's dementia. And more specifically, when we say dementia, what's the difference between Alzheimer's disease and dementia in general? What are the risk factors? So, importante po natin malaman yung mga risk factors, because if there are some things that could lower our risk in developing Alzheimer's disease, then that will be good. When should we see someone, especially a specialist or a physician? And where do we go for help? True or false? Forgetfulness is a normal part of aging. Yes. So the answer is true. So the important thing now is, how do we differentiate between what's normal and what's abnormal? So for normal aging, it's the same thing with our body. When we are younger, nakatakbo tayo ng mabilis, nakaakyat tayo ng puno, nakatalon tayo. Now, when we're getting older, hindi na. Masakit ang tuhod, masakit ang likod. So it's the same thing with our mind. Our mind slows down. So how do we distinguish that then? Stress is not just typical acute stress, but it's more of chronic stress. So kung marami tayong iniisip, mas more nakakalimot tayo. Chronic sleeping problems. If we are sleeping only 5 hours, 4 hours, or even sometimes an hour, those things could affect the memory. We need that deep sleep in able to function quite well. Any medical problems like kidney disease, thyroid problems, liver problems could also cause memory issues. But a lot of times, those conditions, those medical conditions, there are some other symptoms that will tell us that something is going on. And usually, if there's a medical problem, ang nangyari is like it happens quickly. Usually, if it's abnormal memory problems related to dementia, it's usually a slow progressive decline. And one thing I want to emphasize actually is normal pressure hydrocephalus. And the importance about this disease process is that it's actually reversible, and if we don't catch it early, it will cause a permanent damage in the brain. So typically, it's not just a memory problem. There will be new onset o bagong urinary incontinence, so having problems controlling the bladder, and problems with the gait. So diagnosing this disease is actually very important to catch very early on. And sometimes there will be some vitamin deficiency, especially B12 deficiency. Any malignancy or brain tumor or brain mass could affect the memory. Any substance abuse, like alcohol, drugs, and at times we also see patients taking marijuana and it's affecting their memory. So overall, I want to emphasize that it's very important for us to make sure that there's no other secondary causes that's causing the memory problem, because those things are, when treated, those things are reversible. So let's say walang problema, walang hindi depressed, okay ang pagtulog, walang gamot na iniinom na affect sa memory. So now we try to distinguish is if it's dementia. Now, what's the difference between dementia and Alzheimer's disease? When we go outside, pag nag-uusap tayo sa labas, lalo na yung mga kaibigan natin, when we say dementia, they might think actually that it's Alzheimer's disease. Or when we say Alzheimer's disease, usually iniisip nila is dementia. And the reason for that is because Alzheimer's disease is the most common. It's the most common type of dementia. So when we say dementia, it's a very broad term. So just like what you see in the picture, it's like the trunk. So there's many types of dementia. Alzheimer's disease is the most common type of dementia. There's vascular dementia. There's frontotemporal dementia. There's Lewy body dementia. There's Parkinson's dementia. And then there's more than 100, but those are rare ones type of dementia. So I'm going to focus about Alzheimer's disease because again, it's the most common type of dementia that we usually see. It's accounting for 60 to 80% of patients with dementia, and just like what they mentioned earlier, it affects 5 million Americans. And it's caused by an accumulation of toxic proteins which result in the brain cells slowly dying, affecting the cognitive aspect or the cognitive functioning of the brain. And it affects around 2 to 3 million spouses, relatives, and friends with people with Alzheimer's disease. So it's very important, just like what they mentioned. It affects also the family member or the person who's caring for the person affected with dementia. And the cost of care for one person, either at home or the nursing home, and usually yun yung mga private pay, it's around 47,000 per year. And it also affects other medical conditions of the patient, like diabetes, heart failure, and heart disease. And quite very important also is that it affects the health of the caregivers. Caregivers have a higher morbidity and mortality if they're not being well taken care of. This criteria is actually more for the DSM-5, but just to emphasize is that again, when we talk about Alzheimer's disease, it doesn't affect just the memory. It affects the cognitive function of the brain, which involves learning and memory, so they have more difficulty learning new things or retaining new information. They have problems with language, so they might have difficulty with finding the right words or making a sentence. They have problems with executive functioning, so what it basically means is that they have difficulty performing difficult tasks or complex tasks like planning, organizing, calculation, financing. complex attention is like they have difficult concentrating and doing multiple tasks. Perceptual motor, they have difficulty with how they relate themselves to the environment. Perfect example is driving. They have difficulty kung nasaan na sila, nawawala sila, napo-confuse sila. And they have problems adjusting also socially, because when we are conversing with other people, it takes a lot of thinking and thought processing and able to perform properly socially. Milestones might be overlooked. Ito yung importante, I guess, na I want to emphasize sa atin is that during the early stages of the disease, it's hard to distinguish between what's normal and what's abnormal. Yung iniisip natin lagi is nagiging ulyanin nga lang. Pero pag gumagrabe ito unti-unti, is that it's good to catch it early. So things that might be overlooked again is more like yung short-term memory, where we're having difficulty remembering recent events. You might start forgetting what's the date, what's the day of the week, sino tumawag, sino bumisita a few days ago. They repeat the same thing because they're forgetting that they mentioned something already, or if they ask the same question already. They have difficulty in numbers, so it will manifest first that they have difficulty paying the bills. Minsan sabihin nila is like, tinatamad na ako. But usually, ang nangyari is they're having difficulty with the calculations and remembering who did they pay already. They are, again, facing more things, and again, there are changes in the behavior. Yung medyo obvious na, just like what I mentioned earlier, difficulty with directions and routes. They have difficulty with complicated tasks like cooking, paying bills, and driving. The house and things at home are becoming more disorganized, and they have more confusion with simple, basic things. So these are the different stages of Alzheimer's disease. So typically between stage 1 to stage 3, so stage 1 and stage 2, wala pa masyadong napapansin na simptomas. Ang nangyayari is akala lang natin is normal lang yung nakalimot si nanay o si tatay, pero it might be the beginning of Alzheimer's disease already. So stage 3 is where we see those little things already. Friends and family members of the senior may begin to notice memory and cognitive problems. Performance on memory and cognitive tests are affected, and we can see and detect them already when we get the history from family members and when we do memory testing. They have difficulty in many areas, including finding the right word during conversations, remembering names of new acquaintances, planning and organizing, and they usually frequently lose personal possession, including valuables, just like what I mentioned earlier. Stage 4, yun ay mas grabe. Makikita mo talaga na hindi lang usually normal na pagkalimot. They have more difficulty with basic math. They will forget details about their life history. Their short-term memory is really bad. And inability, again, to manage their finances and paying bills. Stage 5 is moderately severe decline. They begin to need help with many day-to-day activities, including bathing, dressing. They have inability to recall simple details about themselves. What I want to emphasize during the early stages is that in the beginning, they will have difficulty remembering recent events. So magugulat kayo is that they remember things from the past more, and quite surprisingly in detail. But as the disease progresses, they will have difficulty with their intermediate memory. And then lastly, they will have difficulty remembering even things that are important in the past. So perfect example is that they will have They will forget the names of their grandchildren or great-grandchildren, and then as it continues to progress, they will forget their children, and then their spouse, and the last will be, they will be even forgetting their parents and what's important to them. In terms of functioning, they will have difficulty first with complicated tasks. So driving, cooking, paying the bills. And as the disease progresses, they will have difficulty with even basic things. Pagligo, pagbihis. So pag nakita kami sa clinic na ang damit nila, minsan naka-bathrobe lang, or even those white, alright, you will see that there are some small stains in their clothes. So that's a red flag for us as something's going on. And as it progresses, they will have difficulty cleaning themselves when they go to the toilet and move their bowels. So again, from the more complicated to the more basic when the disease gradually progresses. True or false? Everyone is at risk for getting Alzheimer's disease.
Yes.
So that's true. So let me emphasize this. Risk factors. Definite risk factors is age. As we get older, unfortunately, everyone has a risk for developing dementia. So when we turn 80s, 90s, nearly half will probably develop Alzheimer's disease. Family history. If there is anyone in our family with Alzheimer's disease, by the time we reach age 90, nearly half also will develop the disease themselves. And the rest, Down syndrome, and there are certain conditions that is more genetically autosomal dominant. Some patients might develop it at their 50s, sometimes 40s, or even sometimes late 30s if they have a strong family history of dementia. And unfortunately, we cannot use genetic testing because so far they have not really proven to be useful in diagnosing patients with Alzheimer's disease, except for those with a strong family history, meaning yung they start family members will start to develop the disease when at a younger age. What are the possible risk factors? So yung una, again, this definites more of age and family history. Possible risk factors are head trauma. When there's a disruption in the neuronal cells, it might be they are more prone in developing the toxic protein. Fewer years of formal education. History of depression. Cardiovascular risk factors. And one thing I want to emphasize, especially in our Filipino community, is like what we eat. Karamihan ng kinakain natin is matataba. Maraming rice. Crispy pata. Tamis. So, masarap. But those things increase our blood pressure, our cholesterol, problems with control of our diabetes, and tumataba tayo. And unfortunately, those things could increase our chance for developing memory problems. Lifestyle, physical inactivity, or mental inactivity. So it's very important to exercise. And addressing depression and stress. And unfortunately, for females, they're more at risk. So crossword puzzle does not prevent, unfortunately, abnormal memory problems. And I think this is the last slide that I'm gonna emphasize, is that we need to address all of these possible modifiable risk factors. Because if we do, there is a 25% reduction in us developing Alzheimer's disease. So, addressing diabetes, hypertension, obesity, depression, physical and cognitive inactivity, and I didn't mention smoking, alcohol also, and any substance abuse. Let's see. Quickly, when we see a physician or when we are ready to see someone, it's quite important to be honest, to be prepared, to tell everything that we are observing with our loved ones. Because we're going to ask all of those things: family health history, ano nangyayari sa mga pang-araw-araw, ano yung mga nahihirapan sila. We're gonna talk to the family members because just like what I mentioned to you, most of them that have Alzheimer's disease is that they cannot give us a detailed history of what's going on. So we need to confirm it with family members. So kung concerned kayo sa memorya ng kapamilya, you have to be there. Because we have seen cases where the patient comes in by themselves and there is an early stage Alzheimer's disease. They present very well. Makeup, earrings, quintas. But after 4 or 5 months, you'll see the difference, they have declined. So if the family is concerned, you have to be there. We need to get a really good information because Alzheimer's disease is a diagnosis, it's a clinical diagnosis. So we rely heavily on the signs and symptoms. And unfortunately, there's no blood test or head imaging that will diagnose it. Okay? And I guess there's no cure. The medications that we have there is in hoping to slow down the process, but eventually it's going to be progressive memory loss. Management of behavioral problems is very important, so it's very important to communicate with the providers so they can give resources and help, like Alzheimer's Greater Los Angeles. Talk about it, acknowledge your feeling, be honest, because ang reaction natin is sadness, magagalit, denial, but it's okay, we're human beings. So after all of those things are done, let's talk about it and plan. And I think lastly is like in our Filipino community, it's like we don't plan ahead as much as possible, but it's good to talk with the family members of what you want, what's your preference, so at least by the time that we're having more difficulty with our cognition or with our comprehension and listening, alam ng loved one natin kung anong gusto natin. My time is up, unfortunately. 5 minutes ago. Language barrier. I forgot about that. Lalo na yung mga medyo nahihirapan to communicate in English or even listening in English, that's a hindrance for them in the beginning sometimes that they don't want to see someone. Please do so because early diagnosis and gathering resources and help from community is very important. Maraming salamat po.